All right, so I have this young, beautiful 31-year-old patient here. She's traveled all the way from the US. We're doing a blepharoplasty. You can see she has heavy eyelid skin here. It's what's been bothering her for a long time. I've marked her incision here about 1 millimeter below her natural supratarsal crease, because when you pull on this tight, you can see how high this skin is. And if we go right in the crease, it's going to be over 1 centimeter, and you want this to be about 8 to 10 millimeters above the eyelashes. So I've marked a laterally directed upward incision, so that if we didn't do that, if we just kept the incision going down, when we sewed it together, it would pull her brow down. It would make her lateral hooding worse. So we do it upwardly directed so that we don't pull her brow. Now I'm going to mark the midline, safe skin excision here. Some textbooks will say to pinch enough skin together that you can open the eye. I like to do it to the point where the eyelashes evert. So it's right there. The eyelashes are starting to evert. So I'm going to mark that. And you always double check everything, measure twice. But if I pull that together, our eyelashes are starting to evert. You can see though that that's close to 1 centimeter of skin that can come out from her eyelids. Now, could I go a bit more? If I do that, I'm starting to get the inversion of her eyelids, so a bit more is too much. So I'm going to do the same thing medially. Again, it's everting her eyelash right there, so I'm going to stay safe here. And then laterally, you usually take a bit more out laterally, but again, you have to watch the brow. Doing that, it's pulling her brow down, so we want to get this to the point where it's tight, but not going to cause lateral hooding, which is right there. So then we connect our dots. And again, this is an upward directive set with epi. We're going to inject, it's a 30 gauge needle. Going to inject laterally, poke, and get a little wheel going here. You can hydrodissect with the lidocaine. So I'm going between the skin and the orbicularis oculi muscle. And you can see how it tracks nicely under the skin. You can often push it and move it forward with your gauze. The most tender part of this is as you get medial towards the nose. I've always warned that's going to sting here, which is coming up here. Right in there is always the sting. So I'm going to push on this just to let it hydrate. So the eyes have been anesthetized. I'm going to try to keep my light off so you can see. So she's numb. So you can do this a number of different ways. You can do 15 blade and cut your pre-marked incisions. You can also do this if you don't have an assistant with an Alice, where you clamp the skin together. And this is kind of nice because it mimics your suture placement to see if you're going to force the eye open. So it's a good little test of the appropriateness of your pre-markings. A third safety test. We've done the pre-marking, double check them, and now here, third check. So I can simulate the excision, and I've not forced her eye open, so I can safely take that skin out. I'm going to use a 15 blade. If you do that, you can just take an iris scissor and then cut along it and remove it. But we're going to do it the traditional way.